My name is Matthew Messler. I am currently 47 years old as of filming this. Today is May 31st, 2024. And about a week ago, I was diagnosed with Polycythemia Vera. And here to talk a little bit about that and the journey so far. And so I have a few facts from Leukemia Society about what I can't really say it well, but Polycythemia Vera, or PV, I'll call it PV for simplicity, what it's all about. So PV is one of a related group of blood cancers known as myeloproliferative neoplasms, or MPNs, in which cells in the bone marrow that produce the blood cells do not develop and function normally. I was recently tested for the JAK2 mutation, the JAK2, specifically JAK2 V617F mutation, and almost all patients with PV have a mutation of the JAK2 gene. This mutated gene likely plays a role in the onset of PV. However, its precise role as the cause of the disease is still under study. And so a little bit about my medical history. I've had like DVT, deep leg thrombosis in my left leg over the years, probably for like 15 years, randomly on and off. I have varicose veins in my left leg, and I also had an ACL surgery years ago. It's always kind of been my bad leg, and just kind of equated any kind of blood clot to when we're doing a lot of traveling or an injury, and I never really thought about it as a potential cancer. So I had been on blood thinners for the DVT, for a few months at a time when I had them, and everything kind of went away. About 2 years ago, I had a DVT in my left calf, and then I felt like it may have been moving or something like that. I was, just making some assumptions here, but I ended up finding something else in my thigh area. So I went and saw a vascular specialist who was on blood thinners for a while. So this is in 2022, somewhere in the March, April area. Went on blood thinners for a bit for those. Ended up having a surgery, which was easy and kind of closed down that bad vein system, etc. Was feeling okay, and then a few weeks after that, I ended up having some stomach pain, and wasn't quite sure. I thought maybe I had developed an ulcer from the blood thinners. Ended up going to the emergency room because I continued to get a little bit more pain in my stomach, and to the point I was getting nauseous and so forth. And they did a bunch of blood work and everything like that, and a bunch of scans. They didn't do a CT scan, but they did a chest x-ray and a number of other stomach scans and MRI, and didn't find anything. But I did have a pretty high elevated platelet count, which was, looking back now, was probably a sign, but we just said, oh, we'll monitor that. So here we are 2 years later. Just 2 months ago, this past March, I was on a good healthy exercise routine and good nutrition, and I thought maybe I had pulled a muscle in my stomach, maybe a hernia or something, but I couldn't really pinpoint it. But I started getting some pain on a Friday morning after the gym, and then by like Sunday night, I had a high fever. Then my stomach started to swell, and then by Tuesday, I went to the emergency room down in Wilmington, North Carolina. The doctors were wonderful, and they discovered that I had a portal vein thrombosis, which basically was lots of blood clots in my stomach. And so it was unrelated to the leg DVTs I'd had previously, but the blood clotting disorder is what what they were concerned about. My liver was very healthy, although it was getting bombarded by blood clots. So if you have a healthy liver with portal vein thrombosis, generally there's something else. So that was kind of the first time I thought about blood clots and related to cancer. So that happened mid-March of this year. Then I kind of went on a journey of blood work and seeing specialists. A GI specialist suggested I get a JAK2 mutation blood screening, and then also a hematologist said the same thing, drew the same conclusion. So that just happened over the course of a few weeks, and about probably last week, or I think last week it was confirmed that I had the JAK2 V617F mutation, which generally will point towards this Polycythemia Vera, PV. So that's where I'm at right now. I've already seen a wonderful doctor and gotten, I'm very fortunate to have some doctors in my life and great friends that were able to just validate the next process. And so I want to share this with you guys, so we can get more into things I can look back at now and see symptoms and different things over the years. A number of doctors have suggested that I probably have had this in my system for a while. We'll never really know exactly how long, but and also one other thing, I am going to be on blood thinners for life. That's been confirmed by over half dozen doctors, we'll say. And then but I wanted to put this video out there. Maybe it will help someone down the road. And also, I'm going to journey the next step starting in June, I think June 11th. I'll be taking Besremi, which is going to be an injection you put into your stomach every 2 weeks, or you can do your upper thighs every 2 weeks for a year. And that is supposed to lower the blood count in my bone marrow, so we're not producing, this JAK2 isn't spitting out too many blood cells and creating clots. That, I'm not a doctor, but pretend to be one on TV. So anyway, I would like to document the journey on Besremi. It's supposed to be the best treatment out there right now, and I will be every 2 weeks we'll be showing you maybe the injection. We'll see how that goes, and see how my counts are. So that looks like every 2 weeks for 1 year. If my numbers are good at the end of 1 year, we will switch to once a month for the shot. And so I'm hopeful that the Besremi will do what it's alleged to do, and there's a lot of good research for it, so I'm very hopeful. One thing that as part of this pamphlet here, it says PV is a chronic disease. Although it is not curable, it can be managed effectively for very long periods, even decades, but it may shorten life expectancy in some patients. So that's what we all hope to not have happen. And other than that, I do have good days and bad days in terms of how I feel, mostly fatigue right now. And the Besremi side effects, it seemed like mostly are like flu-like symptoms for a day or two, and then possibly some like depression and things like that. So I've never really struggled with that, but I know it's a real thing. And so the Besremi can do some thyroid hormonal stuff. So I'm interested to see how that will affect my day-to-day, and just, so we'll keep you posted there. So keep the hope and keep the faith. One day at a time. We really have to just focus on that, and hopefully you have a good support system. I have the most wonderful wife and children and family, my parents, my mother and father-in-law, everybody around me is and certainly my faith plays a major role in knowing that it's going to be okay. So I ask each one of you to keep the faith, and I'll pray for you as you make your own journey. Thank you.